Welcome to Advancing Health. In the second of a two-part conversation, we take a deeper dive into what hospitals and health systems can learn from an initiative from Georgia that's made tremendous progress in improving access to pediatric care closer to home.
Hi, I'm Elisa Arispaguachaga from the American Hospital Association, and welcome back to part two of our conversation with Dr. Gene Sumner, Dean of the Mercer University School of Medicine, and Mark Welsh from Children's Healthcare of Atlanta. We're here talking about the partnership they have made to support healthcare in rural Georgia. We're going to dive a little bit deeper today on how they're supporting the care of today, the pipeline for the future, and some advice for you on how you might create one of these in your community. Let me ask you, Mark, to then tell us a little bit about, you guys have both hinted at the work that you're doing to build scholarships. We know that obviously supporting clinician training is amazing and absolutely necessary, but also takes time, right? You don't grow a physician overnight. So can you tell me a little bit about how you've started prioritizing which of those roles you're focused on and how you're supplementing that pipeline of clinicians and, again, that full team across rural areas?
There are a number of young people who are from rural communities who are receiving their medical education and are, in many cases, the best candidates to return home, to truly return home to communities. And so we have in the pipeline right now 27 scholars. The first two will be in community this year. And so later this year, we will have our first two scholars who've completed residency and will return to rural communities to provide pediatric care. And we're excited about that. I think this is what we look for in terms of a sustainable solution. When we thought about this at the beginning, it would have been easy for Children's to swoop into a community, do some work, and then leave. And that community would have been, better for it in the moment. But in the long run, that would not have created the change across the state that I think both myself and Dr. Sumner hope to see. And so this opportunity presented us this avenue for us to really build a sustainable workforce across the state. And these pediatricians will be exactly that. We started out with young people that were at all different years of their training. And that was a goal to accelerate how quickly we could get folks into community. And now that pipeline is really strong. And we will introduce a next set of scholars in the coming months to continue that. So it's really an exciting opportunity for us to ensure that those over 60 counties without a pediatrician will have one in the future.
That's amazing. Dr. Sumner, can you talk a little bit about the impact those scholarships have had on your classes and your students to be able to really accelerate that return back to home? I know in so many states, the work that has really helped is when they've recruited from those rural areas to go back to those rural areas. Because if you've never lived there, it may be intimidating to move to a rural area.
I think the scholarships are critically important, but I think it is even more important to pick the right student and then give the scholarship. You want a happy doctor. You want a doctor who feels called to that. I think there's no better job in the world than being a small town doctor. I spent my life there. And these young people that are carefully selected, interviewed by a committee, approved, and we track them for years. They have opportunity through their school, through their years here, to visit at Children's, develop alliances with subspecialists and people who may support them 10 years from now, or who may be able to answer a call and have a relationship with them. So we give them incredible opportunities, but we pick the right student. The scholarship makes it possible because they very commonly come from people of lower socioeconomic status or lower income. The first one of the scholars this year, when he finishes, will go back to his home county that I believe never had a pediatrician and still doesn't. He'll be the first pediatrician. So I think that's the shining light. As time goes on, there's an army behind him that will come. And the second scholar that we named has not made up her mind finally, but I suspect she'll be in an area of great need. But they commit, but they commit willingly. It's something they want. And all we do is try to make it easier for them.
I imagine that, they want to see the community they grew up in just be better and have more access to care. And I love that connection. Mark, can you talk a little bit about what it's like for your clinicians at Children's to now have this network of folks that they are communicating with and supporting and being able to keep those kids not having to, and I've driven in Atlanta traffic, man. I don't want to go back. So how do you keep those kids in their communities and keep that connection going and feeling supported there?
I would say that the feedback here has been amazing. When we announced this work and began to share with our physicians across the system, the excitement and energy and desire to participate and contribute to the work was just overwhelming. And because I think for every one of our physicians, for every physician that goes, I would argue into pediatrics, they go into it for a very specific reason. And that desire is purely to make an impact on the lives of kids. And for them to be able to be connected to impacting communities across our state who otherwise are not having those resources, it fills their cup and it makes them better physicians. And they want to be connected to these young people who will return to community. When those young people come to Children's for their rotations to learn, we have a long line of folks who want to engage them and want to be supportive of them. When we go to the Scholars Luncheon every year, it is the most amazing feeling to see those young people and to really energize us in the work that we do. And so I will tell you that it has been a huge, huge win for us in respect to just morale amongst our physicians and employees to know that we are committed to making this impact. And for us at Children's, it really allows us to fulfill our mission in ensuring that kids across the state have access to the best possible care.
I'm going to ask you both, and Dr. Sumner, I'll start with you. The organizations that are listening to this aren't going to replicate exactly what you did because they're not in your shoes, but they're going to hear something that's going to spark a line of thought or a person they may not have thought to reach out to. So I'd ask, what advice would you have for an organization, in your case, Dr. Sumner, a medical school, and in yours, a children's hospital, subspecialty programs? What advice would you have for those listening if they want to create something like this?
Well, first and foremost, understand the problem you're trying to solve. Understand the need. Understand the complexity of if it's rural health. Understand the complexity. It's not simple. And we say children aren't little adults. Well, rural communities aren't little cities. There's a different. It's a different place. People would come and they would run a clinic for 3 months and it was great, and then they'd disappear, or they had a grant and they came and did research and the community never heard from the research, but they see it written up somewhere. And so a lot of trust has been lost. And I honestly think part of that's academia, that we want to change the world, but we don't realize we're taking people uh, who are human like us, and they want to be part of that, and they want to build trust with their providers. So we usually go, when we go out to a community that has a need, we find out what they want, what they need, how can we help you? And we say, if we're going to commit to something in that community, you can't run us off. Unless you want us to leave, we're here. We'll find a way. We'll bring in partners to help. What we heard on all our counties is they have to have health care. They have to have care for their families, because you don't have industry or economic development or education without good health care. So I would encourage anybody to do a little work in knowing the problem and don't take the community as an equal part of that. This is an effort with Children's Health Care of Atlanta, Mercer University, and then every county that we serve in a little different way. We're a little different in every county. We base it on need. If they don't need something, we don't bring it to them. If they want something, we try to find it. Even if we can't provide it ourselves, we get a partner who can provide it. But having a physician in a rural community is important. Having colleagues who answer the phone at 2 o'clock in the morning when you've got a child dying in your ER is equally important. And it allows that young person to go there. Those communities want to have trust in their health system. And many of them have lost trust. So it takes us time to convince them that we're there to stay. And once we become true partners, the needle moves, and that's the magic of it. We do what we say. We don't let them down. If we find we can't do something, we tell them. But we value that third partner in this, and that is the community and being true to our word. So I would say, if you're the institution and want to solve this problem, find out exactly what the problem is, understand it fully, go down and talk to the human beings you're going to be dealing with. Find out what they need, what their priorities are, and start there.
I love that. Mark?
Yeah, I mean, Dr. Sumner said it so well, and I think I would sum that up for us as humility. I mean, it is the willingness to see folks who are collaborating as equal partners in advancing this work, of seeking to understand the needs of those communities and letting them guide you, letting them invite you in, and not assuming that you know better. I think what I've learned more than anything else through this journey is that we have a lot of expertise here at Children's, but there's a lot of things we can learn and have learned from our rural communities, from the way that healthcare has to be approached, from what folks know on the ground. And so having that humility, coupling that humility with trust and empowerment of others to carry out the work. For us at Children's, we came into this with really two things. We said, we want to lend our expertise and we want to lend the resources needed for this to work. But beyond that, we have to trust our partners to carry out the work that is important to them, and entrust these communities to know what is best for their community. That is vitally important. We cannot look at these things through a city lens. I think we fail if we go into it with that mindset. And so I would implore anyone who's interested in this type of work to enter it with humility, to enter it with a desire to empower others to carry out what is best for their communities.
I love that. This is about, you have some expertise that can help support that community. Let them guide you to what it is that they most need and how best to employ it. Well, thank you both for both the work that you've done and the humility and trust you've brought to it. And I can't wait to hear about the hundreds of pediatricians across Georgia that will be serving in the next decade.
I've worked in rural health my whole life, and I am so excited that if we can affect these families and these kids, we're going to have a healthier rural Georgia.
Thanks for listening to Advancing Health. Please subscribe and rate us 5 stars on Apple Podcasts, Spotify, or wherever you get your podcasts.